Hi, I'm attorney Colleen with the law firm of Zachariah Brown. I'm so pleased today to be joined by Lynn During of Bridge Insurance Group. We're here today to do some Q&A. It's now annual election period, the open enrollment period for Medicare. People have lots of questions. They don't know, which plan they should be picking. Do they go with a supplement, or should they have a standalone supplement or an advantage plan, or do I need a standalone drug plan? What's the difference between the different provider networks? And so we thought it would be a great opportunity to use Lynn's expertise to answer these questions for you, and let everybody know that there is help out there, that there are individuals like Lynn that we trust to make sure that you're getting the advice that you need. So thank you so much, Lynn, for being with me today.
Thank you, Colleen, for having me. I love partnering with Zachariah Brown because we refer clients over to you, and we're always thrilled with the results that we hear back as well.
Well, thank you. So we'll just dig right in. But, why don't you start? Yeah, I even messed it up myself talking about it. Can you explain the difference between what a Medicare supplement is and a Medicare Advantage plan?
Yes, I think one of the pieces of confusion, and so much marketing goes out, it's hard to distinguish how many plans are available, but in essence, there are only two paths to cover what Original Medicare doesn't. One is to retain Original Medicare and add a supplement and a prescription drug plan. The other path is a Medicare Advantage plan, or what we consider a replacement for Original Medicare. Unfortunately, there's 11 Medicare supplements, there's 26 prescription drug plans in most zip codes, and there's another 35 or 36 Medicare Advantage plans. So you're seeing all these options, but there's really only two paths.
All right, great. So why don't you explain a little bit too about, we hear Medicare A, B, C, D. What are the different parts of Medicare, and what letters do I need, or, what makes one letter work differently than another?
And that is even another piece that gets very confusing. Medicare Part A is hospital coverage. And for most people who have paid in through their working years, or even had a spouse pay in, that coverage is free. Part B actually has a premium associated with it for most people, but that covers everything outside of a hospital setting, from doctor visits to MRIs, CAT scans, physical therapy, outpatient surgeries, chemo, radiation. Very critical, but it does have a premium for most people. Part C is what we consider Medicare Advantage, or a replacement for Original Medicare. Most of those plans do include the drug coverage, which is the last letter, Medicare Part D, which is Medicare drug coverage. At least they made a connection there. But those are the four main parts that most people should be aware of and understand how they work differently. And that's where we dive into the weeds a little bit and teach you what parts you need, what parts you can exchange, what parts might need it to be added to. So that's our expertise.
All right. So is there any extra help out there for individuals who maybe have lower income or need help with, prescription assistance, affording their medications?
Yes, and we work well on this because we're finding that, especially in a year like this, many of the prescription drug manufacturers are being pressed a little bit. And so they're being more, they're conceding more to having patient assistance programs, helping you pay for your medications. There are also federal programs, which we consider the low-income subsidy, where they'll cap your prescription costs, or PACE or PACENet. There's often a state-based program as well that will help cap your cost on a state level. Then we dive into, do you have veterans coverage? There are many ways to tackle some of the higher costs that can provide sticker shock when you first go to fill a prescription, but we have many ways and tools and resources that we help our clients navigate through.
And how about, provider networks? How do I ensure that my doctor takes my kind of Medicare?
Well, back to question question one, when we talked about the difference between a Medicare supplement and Medicare Advantage. Medicare supplements do not have a network. It is any doctor, any hospital, anywhere in the United States that accepts Medicare assignment. So a supplement is a clean, simple, no network way to approach your healthcare. However, the Advantage plans are all tied to a network. Some of them are small, some of them are larger, and some of them are actually nationwide. So we want to help you when you're looking at that to decide which fit may be best for you.
Okay. And how about affordability? I mean, plans are very expensive. How do we make sure we find a plan that's affordable?
Great question. And part of that is certainly we have to look at budget. One of my first insurance trainers in my business 35 years ago told me the best kind of insurance you can buy is the kind you can afford to keep. So we always look at several factors, not just premium, but access, out of pocket, and what are your medications and copays, if there are any, going to cost. We do have to look at an entire picture, not just what works maybe for your neighbor or your sibling or your cousin, because they may have different needs and different medications and certainly different access. So we're going to look at each factor and make sure that whatever it is going to be affordable for you at our best choice for the long run.
Right. And if I was happy with my plan, in prior years, do I really still need to research every year or look to see what's changed? Can I just, check the box and say, okay, just keep my existing coverage? Or really, should I be looking at it every year to make sure that I understand what the options are?
All of our clients we encourage to review every year for several reasons. Many times it is, if you're in an Advantage plan, you want to make sure your doctors are still in the network for the upcoming year. And if it's one of the prescription pieces, we want to make sure your medication is still covered. I have had situations where someone thought their medication would be fine for another year, only to find out in January, when you cannot make a change, that it was no longer covered and they were paying a lot more. So we do request a review every year, and we're always fee-free. Our proprietary software looks at every company and every zip code anywhere in the United States. So we're doing an unbiased look at your situation specifically.
Well, that's great to know. How about those individuals, we deal a lot with individuals on Medicaid in our office who are already eligible for Medicare and then are now adding Medicaid as an additional source of payment. How do Medicare and Medicaid work together from an insurance perspective?
Great question. And here's where you get a few parties in the mix. Medicare is provided by the federal government. Medicaid is provided by a state. And then you have this third piece, which is often a private insurance company. They will offer what they consider dual eligible plans if you are qualified for both Medicare and Medicaid. Enrolling in one of those often eliminates most, if not all, of your copays. So the cost of all of your care goes down significantly, and they add additional benefits that are not usually available on traditional plans. So it can be very good to explore that depending on your current situation.
That was a lot of great information and a lot of things that I hadn't thought about, and probably those tuning in to watch our video or not hadn't thought about before. If they have additional questions, how can we make sure that everybody gets in touch with you to get their questions answered and make sure they're making the right choice for their family for the upcoming year?
Absolutely. Well, I'm sure you'll be able to provide our information at the end, but our phone number is 724-229-2987. We are licensed in 17 states. And our website is bridgeinsgroup.com. So if you reach us either way, we'll be happy to get a qualified agent to help you.
Well, thanks so much for being here with me today, Lynn. I really appreciate your time and expertise in this area.
Thank you, Colleen.
All right, and thanks for watching.